We're here today on a bit of a more serious note, which is going to be tough because our next guest is delightfully fun and funny. But she also has serious credentials behind her name, a string of initials. And we're here sort of in response to a call we had yesterday towards the end of the program. One of our listeners expressing sadness and depression and a little bit of hopelessness at the state of the world around us. And it really touched us. We talked about it for quite a bit after the program. And there's so many different reasons to be concerned or afraid or depressed out there. And yet we all agree that's no way to live. So we got to find our way to push through. And that's what we're going to do for a while this morning. We've talked with Marli Parobeck a number of times. She is a psychiatric mental health and family nurse practitioner, Dr. Parobek. Let's give you your full due. And Marli has talked about a number of mental health and psychology issues over her few visits with us. And every time we always learn something, we always have a good time. But this is serious stuff now because a whole bunch of Americans are really feeling a depression and a kind of hopelessness based on all of the factors out there of racial unrest, of financial concerns, of health concerns. You name it, we're dealing with it. So, Marli, we're glad you're here. Good morning. How are you? Let's start with that.
Good morning. Well, I've been golfing with my husband. So.
Does that take the stress off?
Well, Jack and I were just talking about ways to reduce the stress during golf. Sometimes there's an adult beverage involved. Sometimes you throw your club. I threw my fairway wood. It felt amazing.
It did. Yeah, you didn't like throw it at your partner there, did you?
No, I avoided the water hazard because I still like the club, but not well enough to
not take out some frustration on it. Well, but in our own kid about way, that is one aspect of working off stress, is getting some exercise and finding something that you do like to do and focusing on that, right? You happened to hear the call the other day, didn't you?
Yes, I did. I was actually on my way to work. As a psychiatric nurse practitioner, I have seen firsthand. Oh, thank you, Lance.
You got to get it closer. There you go.
All right. Just like diamonds, they're always better up front.
That's right.
Up close and personal. So, so as a psychiatric nurse practitioner, I have seen firsthand the effect of COVID. People are depressed, they're anxious. And when we think about the source, it's different for everyone. However, the common core is that people are scared.
Yeah.
Yeah, they're scared for their job, for their health. I don't think that the media or politics has been helpful. Our response to COVID has been more reactionary than being prepared. If we think about how this whole thing rolled out, it was stay home, be afraid of your neighbor, it could kill you. I mean, like if we think about propaganda posters back in the day, what was it, loose lips,
sink ships, yeah,
just things like that. You're looking for spies. I was out and about at a winery in the Lower Valley. A lovely friend of mine was having her birthday party, and the rule was to keep your mask on as you walk around, and then at the table you can remove it. I was literally going to the motion to put my mask back on, and someone mask shamed me. Put your mask back on. Huh. And I responded in kind. I wasn't a Karen. I know who Karen is. Ironically, I own a Karen Terrier, so I thought, wouldn't it be funny if you got T-shirts for Karen Terriers that says "I'm a Karen"?
Well, they're out there, and that adds to the anxiety for some people, for sure. Nobody wants to be embarrassed or shamed or whatever. You're absolutely right. The rollout, we've never really recovered from our rollout because as a reasonable society would expect, information will evolve and change and get better. But the way we've handled it, it's like it's just made it worse. Instead of saying, oh, look, we're zeroing in. It's like, wait a minute, 1 minute this was fine and now it's not, and that wasn't fine and now it is. And so all of that is adding to this. So you find yourself sort of where our caller was the other day. What practically can we do? Not that we don't want to send business your way, because we do, but short of that, or maybe even leading up to that, because you're depressed, get up, get moving around. Well, I'm depressed, that's why I'm not getting up and moving around.
Right.
And so how do we get that first bit of momentum, get inertia working on our side?
So you mentioned it from the get-go. It is so depression, anxiety. It is cyclic. You think, okay, I'm depressed. I don't get up. I don't get up. You know, I'm overweight. My bones ache. It's just. But yes, it's that first initial push of I'm going to get up. People need a reason. We all need purpose, and COVID for many of us has removed that purpose. We're not going into work. We're not visiting our loved ones in the nursing home or even the hospital. So giving yourself a purpose, whatever that purpose is. For example, if I have someone in my office who's severely depressed, and when I say severely depressed, it's someone who has difficulty with the basics, like bathing, eating, changing
personal health, hygiene, that sort of thing.
Personal hygiene, which we all take for granted. I mean, not so much for Jack because he's perfectly coutoured down to the waxed eyebrows.
I know. He calls it, it's blading or no? What is it?
Microblading?
Is that the term that they use?
I don't know. I'm not that fancy. But
anyway, Jack, keep your fanciness to yourself. We're serious here.
Pinky out. So just start with the basics. Make it simple. Make it achievable. So when we think about goals, the same thing would be, with anything. Make it achievable. So for today, I'm going to, call my neighbor. For today, I'm going to buy the seeds I wanted for my garden from Amazon. Just so making it so that it's very practical. If we put something in front of ourselves and we can't achieve it, we're going to fall short, and that just feeds into it.
Right. It's got to be doable, and you've got to be able to then celebrate that success with the willingness to take the next step. Right.
Yes, and you were right about having a routine. And then, so part of the recommendations from the American Psychological Association is to have a daily routine. What I have seen, especially in the adolescent population, is they are up until 2 a.m. On chat lines, playing video games, and then they sleep until about noon. And you also know this if you're on the internet at one time, because the broadband goes down, because that's when they wake up and they're just back on the computer again. And it's like it's unnatural unless you're working the night shift to live like that. And I know it's the summer and people slack off, but that's really no way to live, because people aren't getting out. They're not talking to one another. And when we get out of the phase that we're in and we're able to socialize more, we're losing social skills. We're losing that eye contact, that ability to speak with others.
Even to self-edit a little bit, because we don't online, right? People say the dangest things there.
Yes, there's no accountability. And I think one of the callers had said there's just no civility anymore. We do not value one another intrinsically as each person, just like each creature has worth. We don't see that anymore because we see someone as a potential contagion, like they're going to get me sick, they're going to kill me.
Yeah. Really feel like that in the stores and stuff,
yes.
That you just feel like you're just I even get that when walking down the sidewalk. People will actually move to the other side of the street.
Well, they've been doing that with you for years, haven't they?
I was going to say that.
Dave, you said you wouldn't say that. You said you wouldn't say that. No, but I mean, it's those kind of actions that can really affect some people. I mean,
Yes,
it'd be like,
mentally.
gosh, what's wrong with me? What are you doing? Come on.
There's nothing wrong with you. There's nothing wrong with any of us.
Well, that remains to be seen. However, getting into a routine, obviously great advice there.
Taking a shower, good advice.
Good advice.
Yeah,
really good advice. And then just the idea, like, when you're playing golf, that movement, that exercise, that releases, hormones and chemicals in the body, and that can change mood altering. You don't have to get a runner's high to do some good from getting out and moving around a little bit. Maybe even the exercise is cleaning up your room. I mean, if that hasn't been done since March, maybe that's something that can be done as well. What about the aspect of tapping into professional help? At what point do we need you? I mean, we always need you, Marli, because you're fabulous.
Thank you.
But what from a patient perspective, what would your symptoms be, your quality of life be, before we say, look, I'm not able to do as much of this on my own as I guess I needed to?
Any aspect of medicine really early intervention is best. Just like if someone has hypertension, you don't wait until you've had a heart attack to see your provider.
Right.
So I would say foremost, you don't need a professional until your normal resources have been exhausted. For example, we talked about why are more people going to the therapist in this day and age than they did 20, 25 years ago? Because that is when you met with your best friend and you just vented. You just put it all out there. There was no judgment. They gave you good advice, or maybe they just listened. That is what you get from a professional as well. The reason people are going to a therapist or a psychiatric nurse practitioner in higher numbers than they used to is because we no longer have that best friend. We fear being judged for one of them, and there is a stigma to mental health.
Right. We want to present, we've lost our ability to make mistakes. We've lost our ability to fail and get up and go on and have that be applauded rather than derided. And as a result, we don't express as much of ourselves to others.
Yes.
And as a result, it eats away at us. You're right. If
Yes.
we're going to be, our best friend has to be you. We got to pay you to be our best friend.
Well, that's Mr. Parobeck's job. So yes, when you found that normally what you would do to help yourself get out of a slump, and we've all been in slumps, whether that's
Sure.
I'm feeling a little blue, I buy a puppy, I go for a walk, I do, but when that becomes a pattern and you're like, I can't get out of this because depression, anxiety, it is a hole. We climb out. Oh, I'll go out with my friends, or I'll do this, and it's like, no, it's a pattern. It becomes habitual, and maybe you need therapy. Maybe you need therapy with medications because,
Sure.
as you pointed out,
Yeah.
it comes down to chemicals. And that is a good psychiatric prescriber makes it individualized, just like baking a little bit of this, a little bit of that to match the individual, and it comes down to neurotransmitters and replacing those pharmacologically.
Yeah, and that gets back to lifting the stigma a little bit too. When you realize that it's the system's off. It's not me. It's my system. If I could override and produce chemicals like, all right, brain, it's time for a little more serotonin. Let's go. All right, good, thank you. I mean, we can't do that, right? We got to have some outside help sometimes.
Yes, you can do things, though, to improve your serotonin. I mean, that's why we look at COVID as opportunity for people to seek out ways to make themselves happy. For example, you look at the Humane Society. We have seen an uptick in animals being adopted because people think, okay, I'm home by myself. Maybe I'm home working. People
Right.
adopt a dog.
Sure. Here's my reason to
Yes.
get out of bed because I've got to take care of some loving, living creature, right?
Exactly.
Yeah. Well, the bottom line is, we feel your pain. I used to hate it when Bill Clinton would say that, but we do here. And if folks want to have a conversation with you or get some professional advice of some kind, how best do they do that?
Well, I have not set up my own practice as of yet, but you guys will be the first to know.
Okay.
I think my husband Thomas and I have been discussing what the next steps are. And yes, COVID has changed medicine.
Yeah.
When we think about telehealth or telemedicine, patients are more apt to use it. And the face of medicine has changed in the Valley. We see clinics closing, physicians and nurses losing their jobs.
Sure.
And we've needed to become more creative on how to provide that service, how to stay in business.
All right. So you're dealing with your own stuff. So we can't find you yet. Is that what you're saying?
You can call the studio, or you can call the Yakima Country Club. I'll be golfing. I'll be on the
there
13th
you go.
green.
Check for the various.
I had a great chip shot. Don't make fun of my chip.
I'm not. I wouldn't mess with your chip.
Set up on the 18th hole.
What's that, Jackson?
On the 18th.
Set up the office on the 18th hole. Or at least the 9th hole, because, usually half
At the
the time the
turn.
golfer's about ready to commit Harry Carey on the 9th hole anyway. Because
Yeah, you could help them bring it home.
Yeah.
Make the turn. Make the
Focus.
turn from home. Focus. Be the
the
ball.
Be
Right
the
on.
ball, that's right. Marli, thanks for coming in this morning.
Well, and this laughter's part of it too, isn't it?
That's right.
It's
yes,
a
you can get
mood.
it right here. It's free.
A mood changer and can help and can I think of some of the most traumatic times in my life that humor just seems to be what makes me feel better. You know, you laugh about it, and it doesn't necessarily change it, but it changes your approach and your attitude to it.
That's right.
So and we try to provide a certain amount of humor around here.
That's right.
And every time we say it's 6:05 and time for the news, and Lance starts to speak, you never know what you're going to get for humor there, right? Strangely silent. Just kidding.
Oh, I didn't get that. I just got that, though. I did. Wait a minute.
Wait a minute. That's the news part of the show.
Wait a minute.
What are you talking about? Marli Parobeck, good to see you, as always. Please let us know, because I have no doubt that your background and skills could help a lot of our listeners who get a little sideways, and we look forward to being able to connect you directly to them and not have to find you on the golf course, because who knows if you're at the 19th hole and what's going on there, right? So, Marli, say hi to your husband for us, and thank you very much. Stay healthy. Stay your fabulous self.